February is Heart Health Month, and it's a crucial time to raise awareness about cardiovascular health. Heart disease is by far the leading cause of death in men and women. And joining us to talk about this is Dr. Ajay Yadlapati, a cardiologist with Sharp Rees Stealy. Doctor, thanks for coming in. Appreciate it.
Thanks for having me.
Really important to focus in on our heart, not just this month, but all months of the year. How can we do that?
So I think the biggest thing is take into consideration diet and exercise. I think those are the two staples that we have to do each and every day.
Yeah, I mean, the number one killer, that is shocking, right? I mean, for men and women, so important that we take care of our heart health. What are some simple things that people can do today?
So first, ultra-processed foods. I think we have one of the big things that this administration has been doing and focusing is trying to minimize that.
Sure.
Trying to get out and move. You know, I think one of the things we were talking about is our kids always being on video games. We got to really get them outside, especially we live in San Diego.
Right.
And the last thing people don't realize, sleep. We underutilize the amount of sleep that we get each and every day. Everyone should be sleeping well, waking up, and then if you have any issues, talk to a doctor.
How many hours, and does it vary based on age?
It does. As you get older, our REM sleep, our deep sleep, goes smaller and smaller and smaller. We wake up a little bit more.
Right.
But traditionally, for people less than the age of 50, you want to get at least 8 hours of sleep a day.
Okay, and then even the younger ones, maybe even a little bit more?
A lot more, especially as you remember our college kids and then people who don't wake up in the morning very often.
Yeah.
You know, they want at least 10 to 12 hours for people, especially who are younger.
That can help their brain and their heart and everything.
Yeah.
We talked about the exercise and getting out. I was always told an hour of rigorous exercise. Has it gotten more? What are the guidelines?
It's crazy because everyone is an individualized approach, right?
Okay.
So if you have a young kid versus an older individual, you got to kind of look at it. Overall, two things the way you start. First, get up and move. 7,000 steps a day, not 10,000. They've actually had some good data suggesting less heart attacks, okay, and less heart disease.
Interesting.
And then the other thing that we have to talk about is, besides that, is 150 minutes of exercise per week, moderate, and then vigorous is going to be around 70 minutes plus 2 episodes or working out episodes of strength training.
Okay.
So whatever you want to do, some combination of those kind of factors, and you have to just tailor it.
Who is most at risk then for heart disease? Is it a certain age group?
It's actually crazy that we're trying to talk about this more and more. As we get younger and younger people getting heart attacks, we're starting to notice that, hey, there's a lot more than just environmental. One of the things is genetics. So one of the things that cardiologists do more than anything else is we actually look for prevention. How to prevent something bad from happening.
Okay.
So if you have a family history of heart attacks, heart disease, talk to a cardiologist and get tested early.
You want to know your numbers, right? And what are those numbers and why is that so important?
So again, we're going to go into this individualized approach. Don't look at the numbers, each and every one, and looking at the scale and where you are at.
Yeah.
So the three kind of overall broad numbers, your blood pressure less than 120/80, your hemoglobin A1C. What that means is your sugar level is less than 5.7%. And then honestly, I think the biggest thing that we have to take a look at is your waist, your circumference. So what's happening is if you get that belly a little bit bigger and bigger and bigger, there's a lot more insulin issues, and more importantly, you're going to get more cardiovascular complications.
All right, that's where that exercise certainly is super important. We talk a lot about, you talked about the bigger belly, diets. You know, is there a diet that can help with the heart, and if so, what is it, and why is that helping?
So interestingly, if you look at, there's about 1,000 diets out there, right? There's not one that's kind of said, hey, this is the best overall. Again, individualized approach. But what's interesting from a heart healthy standpoint, a Mediterranean diet.
Okay.
So basically what that means is fish. You want to have good olive oil, nuts, legumes. These are the kind of the substances, and then of course a lot of fruits and vegetables.
Those wearables that are out there, the Apple Watches, you said 7,000 steps. People track. My kids enjoy telling me how many steps I got. But there's a good reason to maybe wear one of those, right?
They're great. They're not a substitute for a cardiologist, but what I always say is get that information and give it to your cardiologist to help.
You got a quick website?
Yeah, go to sharp.com and then also /Sharp Rees Stealy. Great, we have great information about heart health, especially for the month.
All right, keep that heart healthy. Thanks for coming in, Doctor.
Thanks again.
Taking a quick break. We'll be right back.